If you have ulcer, watch this video. This might be the last treatment that you will have to cure your ulcer. This might aid you not to have ulcer again. There are some erroneous words that people will tell you outside there that causes ulcer. Number one, they will say when you are hungry. If you have no eating, that hunger causes ulcer. Taiwo, Modupe is a lie. Some people will say too much of pepper causes ulcer. My dear, na lie. No believe am. No be so. What causes ulcer? Ulcer is, for example, you are eating sweet things, you are eating like suya or some other meal, and you mistakenly bite your mouth. When you eat pepper, what does it do? It will pain you. That is how it is in your stomach. Ulcer is simply means having wound in your stomach or at the top of your intestine. And when you have wound and use pepper, definitely, exactly, it will pepper you. Just like having wound in your body, apply pepper. How will it be? You see, you have excruciating pain in you. That is how it happens inside of you. Now, let's go to the points now. There are two things that causes this ulcer. Two things. Sit down, listen carefully, and adhere to these terms and conditions. Don't hear those lies anymore. Number one thing, there's a germs, small germs called H. pylori, Helicobacter pylori. It's a bacteria that when it's being trapped into your stomach, what does it do? It will heal your stomach gradually, heal the wall of your intestine gradually, and what causes what? Wound. It's open wound. And note that acid is inside the stomach, and when acid started to invade into that wound, definitely it will cause pain in you. Number two, painkiller. Wow. Any small thing, painkiller, headaches, stomach pain, body pain, every area, leg pain, head pain, painkiller. And there are some drugs that affect the mucosa of your wall. Example of this painkiller are diclofenac, ibuprofen, and aspirin. These are the drugs. When you take them too much, when you take them often, it will create ulcer, thereby disrupting the wall of your intestine and making that place open for wound. And if you have go to the hospital, that is the two things that cause ulcer. If you have go to the hospital, they have diagnosed you, and you know that you are positive to H. pylori, definitely you are having ulcer. What you need to do is go to the hospital and meet a physician. What did they do? Number one, they are going to administer a combination of antibiotics. And after they administer antibiotics, what does the work of the antibiotics does? Is to kill that bacteria, to destroy that bacteria, that Helicobacterium pylori inside of you. And also, they will add something to it to what? To reduce the pain inside of you. So that as it's killing that bacteria, to reduce the pain. And also, they will administer PPI acid. What does it do? PPI acid, such as antacid, omeprazole, and waterfill. What does it do? It will try to inhibit the acid wall in your stomach, thereby making that wound to get healed as quick as possible. That is its work. It does. So that, and those drugs, you must complete your dose. It takes 2 weeks. You must complete it, or more than that. Make sure you complete your dose. And you stop using that painkiller. When you are treating it and you are using that painkiller, I'm telling you, you are elevating the issue inside of you. And note that you will stop eating pepper at that particular time. You have wound and you put pepper, it will pain. Definitely you are killing something inside you and you are still eating what is trying to increase that pain, not to allow that place to get ill. You are the one causing it. And also avoid fatty food when you are taking that medication. Avoid fatty meals so that that place will get ill. And after doing these measures, make sure you adhere to doctor's prescription. And most important thing that I want to tell you, some people will still having ulcer and they will still be drinking alcohol. They will still be smoking. They are trying to create difficulty, arduous in their war. It can kill. It can kill. Stop it. Instead of you taking all those harmful substances, you can eat egg, eat vegetables, and some other nutritional diet that will aid that place to get ill on time. If you are having stomach pain, don't take self-medication. Go to the hospital, let them test you, and let them give you appropriate medication. Thank you, and make sure you adhere to these terms and conditions I've given you free of charge. In my next video, I'll talk more on this ulcer. Bye.